Joining us now is Dr. Maxine Lewis. She is the Chief of Mental Health and Addictions with Niagara Health and also St. Joseph's Healthcare in Hamilton. Welcome, Maxine.
Thank you. Nice to be here.
Maxine, with the long weekend behind us and, we're looking at the difference between the social distancing that we've been used to and all of a sudden some things being opened up. Is that a chance for people's anxiety to increase?
I think quite a lot of us have been feeling anxious and rather isolated at home. So, of course, having some restrictions relieved might make some people feel better, particularly as the trails and outdoor spaces open up a little bit and the chance to get out and be with people a little bit, or at least see people. That might help some people's anxiety. But then the other side of it, of course, is that, with the media sort of focusing on the risk of potentially contracting COVID, then we're all going to be worried about, what do I do if I don't have a mask? What do I do if I'm in a situation where someone else isn't following physical distancing? How do I respond to that? So I think it can go either way, I think.
This anxiety that a lot of people are experiencing during the pandemic, a lot of it comes from the uncertainty and the loss of control over what goes on in people's lives.
Absolutely. And I think that you've got to the crux of it there. I think it's that piece about not being in control. I mean, we all like to have control over our lives. COVID is something that we really don't know a lot about, even now. And it's really changed our lives substantially. But I think the important thing really at this time is to focus on what we can control. So I think what I've been focusing on with my patients and even in my own life is focusing on, maintaining a routine, really focusing on making sure that I'm eating well, sleeping well, drinking plenty, making sure that I do some things that I enjoy each day. Those really focusing on the things that you have control over.
Another part of your job is dealing with those with addictions, linking addictions to mental health. While the restrictions are being lifted, how does that affect people who are potentially addicted to alcohol, to drugs?
It's interesting because there's been a lot of discussion about the fact that LCBO was still open during the restrictions, and a lot of us in the mental health field were actually quite relieved that they were still open, because those of us who look after people with alcohol addiction recognize that people still need to be able to access alcohol at some point to prevent a withdrawal. And I think the isolation, the anxiety, the depression that people have been suffering over these last few weeks has caused many people to turn to alcohol and maybe other substances, but perhaps more so than they would have done otherwise. So I think as restrictions reduce, I'm actually hoping that people will be able to find other outlets. But certainly the people that we see who have significant addictions, I'm also hoping that with some relieving of restrictions, we'll be able to provide a bit more care, maybe one-to-one care over the coming months. Because, of course, that's been cut back quite significantly with the COVID restrictions that we've had in place.
Certainly a lot of the dealings with people with mental health issues and addictions issues, it's all been via video conferencing, I would imagine, and that makes the job a lot more difficult in some ways.
Yeah, more difficult in some ways, and actually some patients have actually said how much they like it. So with some patients, particularly our younger population, they've actually found that having access to video conferencing has been preferable to having one-to-one. And of course, with video conferencing, you don't have the the same trouble with parking. You don't have to pay parking, for example, at the hospital. You don't have to travel. In some ways, it's easier for the clinician. There are restrictions, of course, and some people don't have access to phones and the ability to use video conferencing. So actually, in our Niagara service, we have been handing out phones to some patients who don't have any access otherwise to be able to maintain that contact.
Dr. Lewis, thank you for joining us today on The Source.